Initially I came into medical school thinking I would be a family practice doctor. My grandfather was a family practice doctor in Two Harbors, and what felt like my calling. And as it turns out, I was drawn to psychiatry by the connection with the patients. And so it was serendipitous that when I arrived at St. Luke's, they said, we're starting a telemedicine program, and we're wondering whether you wanted to be involved. I think what we see with people in the public eye who are going through a serious mental or behavioral disturbance is that instead of being viewed with empathy by the public, they're viewed with ridicule and something to be laughed at.
To actually drive an hour and 45 minutes in the wintertime where we live up here sometimes is not only treacherous, but maybe even life-threatening. But it's also a cost. It's a huge burden, and a lot of the patients, especially in mental health facilities, tend to be chronically underemployed. As family practice physicians, we're probably the most trusted source for access to mental health. Now being able to come into their regular clinic where they get all of their care and they can actually get psychiatric care or any other subspecialty care really does take away that stigma and that fear. My patients constantly will tell me when I see them in the hallways or even for follow-ups that they're really happy that we have the telemedicine now, because it was a huge burden for them to have to go to wherever I would send them before.
Because of telemedicine, no longer will your zip code prevent you from accessing critical services like psychiatric care.